Welcome to the channel. We are Maintain Me Senior Services. I'm the owner, Chelsea Sweeney, and I have Desiree here, who is our transition coordinator and the founder of our home style and design program. We are going to be covering a very interesting topic today because we are kind of crawling into respiratory season. What we like to do on this channel is educate you as we go through all of these different seasons and through our life and through the year. So if you're liking that content, hit the subscribe button, give us a thumbs up, and hit the notification bell so you're notified every single time that we put out a new video. And today we're going to be talking about 5 things that you can do to prepare as we crawl into respiratory season. Stick around to the end though, because we are going to give you a bonus topic based off of, being a nurse and kind of some things to prepare for if you do actually get sick. So Desiree, go ahead and start us off.
So number one, and it's basic, we all know this, but we all have to be reminded of this. We all fall very short of this when we're in a rush and life is busy, is wash your hands. Wash your hands as often as you can. And I know you're at the gas station, you're pumping gas. There's not a station to wash your hands. So you use a hand sanitizer, which is great. It's a great supplement. But when you can, and when it's an option, wash your hands over the sanitizer, because after a couple of times it's just building up on each time you've put the application of hand sanitizer in, and it's not really doing its job, its purpose. So the best thing to do is wash your hands when at all possible. And if you live in Colorado, your hands are going to dry out. So keep some lotion with you.
Exactly.
I have lotion in every sink of my house, in my purse, in my car, because it is Colorado and you will dry out. But washing your hands it's the best thing you can do.
Absolutely. The second thing, again, no brainer, but I'm going to give you a couple tips. That's going to be keep your hands away from your face. Okay.
Yeah.
Now, everyone's like, duh, Chelsea, keep your hands away from your face. However, Desiree just talked about how it's dry in Colorado. What's the first thing that some people do when it's dry? They put on chapstick. Guess what? Not all chapstick comes in a tube.
Nope.
They put their finger in the thing, they wipe it on their face. Or maybe you have your hair down and you're doing this. Or maybe you're blowing your nose, or you have a runny nose. Maybe you're on oxygen, and we all know how the oxygen makes your nose run. And you're playing with your, nasal cannula or whatever it may be. So it's not even just, being a 5-year-old saying, don't touch your face. It is all the little things that we do to maintain our life with chapstick and our nasal cannula or whatever it may be. Maybe you're putting on your makeup. Maybe you use a sponge and wash your sponge more than you use your hands. So little things like that we wouldn't think about as adults versus our kids touching and licking themselves. We're not talking about that. We're talking about little things that'll keep your hands away from your face, because we don't want you to be afraid of touching things and getting out and doing things. You just have to be a little bit more aware during respiratory season.
Exactly. And that leads us into number 3. And it could be hard, but keep it in the back of your mind. If you are going to be having people come over to visit, whether it's 2 to 3 people, try to do it in the dining room, in the living room. And if it's a nice sunny day in Colorado, go outside, sit on the patio, try to do it in an open space. So if somebody does have the sniffles or is just getting over something and they sneeze or they cough, it's not directly landing on any of your personal effects, like a pillow, your couch, your throw, even a sweater. You'd be amazed how long bacteria likes to hang out for.
Yeah.
So if you can meet in a larger area, that's great. If you live in a community, meet in the community open rooms, the living room, the activities room, the dining room, anywhere that you can have open space with open air that's better for you. And you don't have to, worry about it.
Absolutely. That takes us into the 4th thing, and that is cleaning your high touch surfaces. Now this, we don't want the last thing we want everyone to do is to seclude themselves away from people during respiratory season. We feel like after, the big COVID word came, a lot of people secluded themselves, and we found out very quickly that that was just hard on our souls. We are meant to be connected, and we want to be connected, and people need that. And so what we do is sometimes if you are having a more intimate setting or, greeting with your family and friends, and maybe they are coming to your apartment, I want you to also be, cleaning those high touch surfaces. You already in assisted living communities will have kind of light housekeeping coming in, but that's not enough. So if you do have little practices each week of going in and cleaning up those high touch surfaces with disinfectant wipes, that will make a huge difference when people are coming into your own space, whether you're sick or they're sick. Cleaning that up will make it to where you have a less chance of getting the sickness or getting that little cold that will be going around. We know you can't avoid it. It's going to be just taking little practices each day.
Exactly. And number 5 is eating healthy, eating smart, staying active, drinking lots of water. I mean, it's a practice we should do throughout the year, but again, we tend to fall short of that. And when a donut arises, we're going to have a donut. But it's, eating your vegetables, it's eating high fiber food, it's staying active, doing your daily walks as much as possible, whether it's in the morning, after lunch, after dinner. If you can do it multiple times, the better. The more active you are, the better. Because if you do get sick, it's going to help. It will help in the long run. And the other thing is drinking lots of water. We are a dry climate for Colorado. So we already drink lots of water, but during the season, kind of up the ante just a little bit more. And if you have to put some lemons or some mint in it to make it a little bit more appealing, do so. But drinking lots of water does help and does go a long way.
All right, if you stuck around this long, we promised that we would give you a bonus, and that's going to be if you are getting sick, little things to do to help with that sickness. So the first one is going to be kind of the water thing, right? As soon as we get secretions, it's a lot of times it will start to, we'll get sinus infections because it'll start to, get our nose clogged. If you drink a lot of water, that'll loosen the secretions, not only in your nose, but also if anything were to travel down towards our lungs. Another thing that we find very helpful is Vicks. If your eyes can stand it, if you take Vicks, not with your finger, because we told you to not touch your face, so get something to put Vicks on. But if you dab it with, say a tissue and you put it right under your nose, try not to get too crazy or you'll start crying. But if you do that, it'll help you keep your airway open. It'll allow it to sort of those secretions to, kind of get rid of themselves. Blow your nose, don't suck it up. Things like that will allow it to kind of flush through your system. The other thing we find extremely helpful is, say you have a sickness. If you were to put a pillow, you don't have to do this, ask for help, put a big pillow or a couple pillows underneath your mattress to make your mattress slightly elevated. It will again help with that draining, which will then make it where things aren't stuck where they are, whether it's in your nose or your lungs, leading to things like sinus infections or pneumonia. Another thing is going to be the eucalyptus and peppermint oils, whether it's going to be in a diffuser or if you're going to be, rubbing it on your wrist and, smelling your wrist or whatever it may be. That's another way to keep your airway open. What we don't want to do is see you have any issues with breathing. We want to keep that airway open and moving and flowing, which then leads to the most important thing. When we are feeling crummy, all we want to do is rest it off. And yes, rest is great for when you're sick. However, if you are laying in a supine position and you are not up and you are not moving, those secretions are going to sit and they are not going to be able to flow out of your body or break themselves up to get rid of the sickness. So even if it means getting in an upward position, repositioning multiple times, walking to the door and walking back to the couch, or walking to the couch from the bed multiple times a day, you're going to be breaking up the secretions that you do have, and that's going to allow them to leave your body and get you better, faster. What we don't want is you laying in bed, getting pneumonia, because that is going to be a very different recovery than, say, the common cold coming into respiratory season. One last thing before we close up this video. Because of respiratory season and living in community settings, if that is you, I also would ask your doctor next time that you are there, do we have a lab that we work with? Do we have something that can test me quickly so I could be treated? The moment you start having symptoms, don't just chalk it up as a cold. Get a quick little test. Make sure that if you do have something going on, that it can be treated. A lot of people just think, COVID doesn't have treatments. Maybe it's COVID. But if you do have a little underlying respiratory illness, it could go untreated. So be aware of what's available to you. Make sure you're communicating with your doctors and nurses that are traveling around to your communities. Or if you are going to the doctor, make sure that you have somebody on hand that can take you to and from the doctor to make sure that you're keeping the communication open with your doctor and treatment is being done quickly. So, all right, we have talked about 5 things to consider. And if that little cold sneaks through during respiratory season, little things you can do to help it push away. So if you are liking this content, please hit the subscribe button, give us a thumbs up, and hit that notification bell. Every single time that we put a new video, you will get a ding going through your YouTube, and that's how we like to stay connected with you. And feel free to comment down below. We want to hear from you. We hope this video is helpful. It's the basics, but we got to remember during respiratory season. So until next time, see ya.